Of course, we're going to collect evidence as appropriate if the patient desires that. Even having the evidence collected does not still require them to report to law enforcement. The choice is entirely theirs. We will offer testing for sexually transmitted infections. We offer pregnancy prevention. We have a couple of different options that we can use, including the morning after pill, or we can even make referrals for a highly effective copper IUD contraceptive. We also offer vaccinations, including hepatitis B and human papillomavirus, which is a cervical cancer vaccine, when it's appropriate for certain patients. Every sexual assault patient who's seen at the Center of Hope will have their chart personally reviewed by myself as the medical director. I'll make a personal phone call to them, discuss all of the follow-up recommendations that are specific to their case, write them a letter explaining in detail what types of follow-up medications, treatments, testing they might need to expect, and hook them up with any further resources. We even offer medication, when applicable, that can help prevent the spread of HIV.
We are there to make sure that in the case of sexual assault, that we want them to start the healing process emotionally, physically, mentally. We bring in advocates. We bring in crisis if needed. Whatever the patient needs. Do they need a shelter? We're going to help find them a place. Do you not have enough money? Then we're going to give you the victim's compensation form. Do you need clothing? Well, we're going to work on whether it's just a pair of shoes you need, or do you need a winter coat? Do you need a jacket? We focus on wraparound services.
The title of it in and of itself, I just absolutely love. That it is a center of hope, because we want to give hope to patients. They may walk in not knowing what to do, where to turn, what's next. Many of them are depressed and sad, and even question, is life even worth living after something like this happens? And we give them that hope that it is, and that there is healing, and that there is pretty much light at the end of the tunnel. It may be a long journey, but they can get through that.